Hello, my name is Peter Lawrence, and I'm pleased to introduce the February issue of the Journal of Vascular Surgery, and to highlight 4 outstanding papers that are freely available for the next 2 months. Our editor's choice article for this issue is entitled "A Report from the Society for Vascular Surgery Valuation Work Group on the Value of Modern Vascular Surgeons to the Healthcare System" by Richard Powell and co-authors. Vascular surgeons provide an important service to the healthcare system, and since they're capable of treating a wide range of disease processes, and their presence allows a greater complexity of surgical services that a health system can offer. Because of their ability to control hemorrhage, they're also critical to maintain a safe operating room environment. The vascular surgery service line also has a very positive impact on hospital margin, both through the direct vascular profit and loss of $1.6 million per surgeon based on the average of 8,423 RVUs, but also an indirect result of assisting other surgical and medical services in providing care. These financial benefits will remain in a wide range of alternative payment models, such as bundled payments or capitation. Our second article is dual fluoroscopy with live image digital zooming significantly reduces patient and operating room staff radiation during fenestrated branched aortic endograft repair, or FBVAR, by Laura Timuron and colleagues from Southwestern. They report on radiation doses of 2 fluoroscopic techniques used for the fenestrated BVAR, that is, comparing standard magnification versus dual fluoroscopy with live image digital zooming. Intravascular ultrasound, 3D fusion, and extreme collimation were used in all the procedures, with intraoperative imaging performed using one of 2 systems, either standard magnification or dual fluoroscopy with live image digital zooming. Procedures performed with dual fluoroscopy demonstrated significantly lower median patient and primary operator radiation doses when compared to standard magnification. Among the most complex device procedures, operator radiation dose was reduced by nearly 1/2 with digital zooming. The next article by Dr. Fernando Mata and colleagues, and entitled "Performance of Viabond Balloon Expandable Stent Compared to SelfExpandable Covered Stents for Branched Aortic Endograft Repair," was an analysis of 62 patients that had 177 branches incorporated into a fenestrated BVAR repair using either Viabond balloon expandable or self-expanding stents. There were similar branch patency outcomes of approximately 98% using each stent, and freedom from branch-related endocrine leaks was also 98% in both groups at 24 months. The authors concluded that these stents performed similarly in the first 24 months when used in conjunction with custom manufactured devices for branched endovascular aortic repair. The final article by Mathuli and co-authors is "Increased mortality with Paclitaxel Eluding Stents is driven by lesion length." Endovascular stenting has become the first line of treatment for symptomatic PAD of the femoropopliteal region, and several clinical trials have reported that Paclitaxel Eluding stents significantly reduce the rate of restenosis. However, a recent meta-analysis showed a significant increase in all-cause mortality following the use of these stents. A retrospective review of 296 patients who underwent femoropopliteal stenting was performed, with patients grouped into bare metal and drug-eluting stents. 100 patients, or approximately 4%, received the Paclitaxel stent, while 195 patients, or 66%, underwent bare metal placement. The 2-year all-cause mortality estimates were similar for the paclitaxel and the bare metal stent groups, and there were no differences in the 2-year limb salvage, primary patency, primary assisted patency, and secondary patency. However, among patients with longer TAS C and D lesions, the paclitaxel stents were associated with a significantly higher 2-year all-cause mortality of 24% versus 5% for bare metal stents. These findings were seen among patients who required multiple longer stents and potentially larger paclitaxel doses. Thank you for watching. For more information, please follow us on social media and remember to like, comment, and share. We hope you enjoy these 4 highlighted papers and the other excellent papers in this month's Journal of Vascular Surgery. Remember that these articles are free to read until the end of April. And thanks for your attention.